So what we're looking for in terms of this is that the strength of this finger is normal. Pull that finger down. Like I can't straighten that out at all.
Yeah.
And relax here, pull your thumb down like that. I can't straighten that out at all.
Wow.
And your thumb, we're looking for skin limiting your motion and no subluxation. And relax your hand. And when I load this, it feels like a glass, which it does.
Yes.
And you've got at least 45 degrees wrist flexion. And relax your hand. And when I push on this, it doesn't dislocate anymore.
Yeah, and this hasn't been bothering me either.
It looks great.
Yeah.
And your tendons here, which were subluxing, are right where they're supposed to be. And you've got a little bit of adhesion here. But you just started working on it.
I just
so
started.
That's going to be fine. And you can hardly see the scars.
Yeah, I know. Isn't that amazing?
So anyway, part of this is me and part of this is you. So this is about as good as it gets. And you're definitely a scar former, like we might be related. You had an injury here, a tortoise ligament off in December and had it repaired. And the skin here has done sort of the same thing as yours, which is really sickening. Anyway, people with this sickening as a group tend to be stubborn people with a high pain threshold.
Yeah, yeah.
Who come in late with multiple problems rather than early with one. And these operations are a little bit more reliable. Like the chance of recurrent instability here, 0. Chance of recurrent instability here, 0. Chance of recurrent instability here, 0. Recurrent subluxation here, 0. And this feels okay now too, doesn't it?
Yeah, oh yeah. And my elbow, again, like when I hold it out, it's straight. And when I hold this one out, it pops. It bends.
Yeah.
And it's such a huge difference. Like this one's straight and this one's bent. So it fixed that pop. And when my neck and my shoulder, all the doctors that I felt have felt that this side is so much better than this side. Yeah, it just
It's
like
an indirect thing.
yeah, my even my shoulders, like this is sitting forward. Yeah. Yeah, it's tricky.
It is tricky. That's a good way of describing it. It's kind of tricky. Let's check. Stand up. Let's check your supraspinatus muscle. Look at that.
Oh wow. Yeah. And this one can't do it.
Relax your arms. Hold them right there. Don't really push them down. Like I'm pushing as hard as I can.
Yeah, you are. That was working my arm.
Do that again. It's definitely weak on that side. That's what happens when you're scapula, where it's supposed to be for a couple months.
Yeah. It's amazing. Yay! Oh my God, thank you so much.
I love my job.
No. And I'm so glad you're doing this hand.
All right.
Okay.
Did you get all that?
I did.
So now let's do our right side.
Yeah.
So, I have a couple patients who've posted these things on TikTok.
Yeah, I saw one of them.
You can post yours on TikTok if you want. So you have a nerve problem here.
Yeah.
No symptoms where the problem is. It gives you painless weakness these two muscles. And if you relax your hand, if you just look at your hand, this finger should be here.
Oh.
And it's here.
Oh yeah.
And
Yeah,
that
'cause
has
these
to
are
do
all-
with the passive imbalance of the muscles innervated by this. And your thumb should be here. So it's really subtle things. Make a fist for you. Pull down as hard as you can.
That was me pulling down as hard
So
as I can.
that's how strong that should
Yeah.
be. These
Yeah.
muscles are all the same size, same shape, same weight,
It's like
same
no
vectors.
strength there.
And your thumb is on the same track. So pull down hard. But you can do this. Now pull down, and it works fine.
Yeah.
And pull down with that, it works fine. But then people get sore here,
Yeah.
right here.
Yeah.
So your thumb, the relaxer hand, is not really attached to you. You have a
Whoa.
small hand.
I do.
And this feels okay when I do this, but it's not supposed to do that. And this gets sore, like right here. And this tendon,
Oh,
you might have to come in
I
closer.
heard that
so
pop.
this tendon is supposed to be here.
Oh, that pops. Oh, that's
and
weird.
it gets sore going
Yeah.
sideways.
Uh-huh.
Anyway,
That's
well,
weird.
and people of that have this, where this tendon is supposed to be there, not there. And there's a tendon all the way over on the side here, which I'm not sure I can actually bring up far enough to show you. Anyway, when we fix this one, it usually makes this one more unstable. So, and are you sore here like you were on the other side?
It's a little, but very, very little.
Well,
Like it's more like
Yeah,
pressure.
Yeah, we're gonna ignore that.
Yeah.
And this is me relaxing, and this is me dislocating your wrist.
Yep.
Like you can see that, can't you?
Yep. I can feel that, like the bone. I
And
can
this
feel
is
the
from
bone.
the side.
Oh yeah, that's nothing.
I'm pushing as hard as I can, and it's
Oh
going
my God,
nowhere.
that's awesome.
Anyway, this is why you are why I haven't retired.
Thank you for not retiring. I have a few people wanting to see you.
Wasn't this amazing? It's like a life-changing event.
Oh my God, I can't wait.